First, I would check the patient's chart. I would gather any equipment that I need. I would wash my hands, put on any PPE that I'm going to use, and go to the patient's room. Knock, knock, knock. Can I come in?
Yes.
Hello, I'm Libby. I'm going to be your nurse today. Can you tell me your name and date of birth?
Ryan Gould, February 17th, 1989.
Fantastic. So first, I'm just going to ask you a couple questions. We're going to do a full body assessment today. Should take like 10, 15 minutes, not too long. You have any questions?
I do not.
Great. So, can you tell me what you had for breakfast today?
Eggs and bacon.
Can you tell me the last time you were here?
Probably about a year ago for my last annual checkup.
Okay, where is here? Where are we?
The doctor's office.
Okay, and what are we doing?
My annual checkup.
Fantastic. Okay, so first I'm going to start with your head. I'm just going to feel around a little bit. Let me know if you have any pain, tenderness, anything like that. I don't see any lumps, lesions. Hair looks evenly distributed. Don't see any dryness, anything like that. Face looks normal cephalic. Symmetrical. And we're going to do a little eye test here. So I'm just going to have you look at my nose. I'm just going to test your pupils here. And they constrict as they should. Now I'm just going to have you follow my fingers. Don't turn your head, just follow with your eyes, okay? Great. Okay. Sclera looks white. Conjunctiva is pink and moist, as it should be. I'm going to do a little whisper test here. I'm just going to stand behind you, tell you a couple words. Just repeat them back to me, okay?
Okay. Puppy paper mirror.
Yes, fantastic. And then I would do the other side as well. I would, if I had the tool, I'd look in your ear, right ear. Cone of light should be at 5 o'clock. And on the left ear, cone of light should be at 7 o'clock. Your nose is symmetrical. I don't see any extra discharge or obstruction, anything like that. I'm going to do a quick test here again. I'm going to have you close your eyes and hold a finger over one nostril.
Okay.
And I just want you to tell me what you smell here.
Smells like peanut butter.
Fantastic. Now I'm going to have you do the opposite side. What's that?
Still smells like peanut butter.
It surely is. You did it. Okay. So now I'm going to check your mouth. Mouth looks symmetrical. Lips are pink. Not too dry, not too moist. Everything looks great. Go ahead and open your mouth and say ah. Now go ahead and stick your tongue out. And while your tongue is out, go ahead and say light, bright, dynamite.
Light, bright, dynamite.
Fantastic. Okay. Now I'm going to have you open your mouth and clench your jaw. Fantastic. I don't feel any TMJ or anything like that. And now I'm going to do a little neck test here. I'm going to check all 10 lymph nodes. We've got submandibular and some other ones. We know you got 10 of them. Okay. I'm going to have you go ahead and swallow. Okay. You have any pain with that?
Nope.
Great. Trachea is in the center here. Skin feels warm, but not too warm. No sweating or anything. Let's see. I'm going to pinch your skin here. Turgor is good. Goes right back into place. Skin is a nice tan color, which is appropriate. No swelling. Nothing like that on the swelling scale. Now I'm going to have you shrug your shoulders here. Fantastic. Okay. Now, with your hands, I want you to do this with your fingers. Great. I don't see any clubbing there. And I'm going to take one finger and do a little capillary refill. And it comes back in about 1 second, which is also good. So now I'm going to have you do a muscle test here. I'm going to have you go ahead and stand on up. I'm going to help you up here. And I just want you to close your eyes and just stand for a second. Great. Balance looks good. You can go ahead and open your eyes now. Now I'm just going to have you start here and walk to the other side of the room. And I'm just going to watch you walk. Fantastic. Gait looks smooth and symmetrical. Nothing crazy like that. Now I'm going to do check your joints here. So I'm going to have you move your shoulders. Make sure we got full range of motion. Move your wrist. Move your ankles. Great. Now I'm going to do a little strength test here. Go ahead and squeeze both of my hands. And then I'm going to have you push against my hands. Push against my hands this way. Go ahead and have a seat again. And actually, before you sit down, I'm going to do a quick scoliosis test. So go ahead and bend over. All right, and stand back up. Okay, spine is nice and symmetrical. Now you can go ahead and have a seat. All right, and now I will have you push against my hands. and then come back this way. Great. So now we're going to do a heart test. Your heart is, the base is at the right sternal border, apex is at the 5th intercostal space. So now I'm going to listen to your heart here, 5 different spots.
Okay.
All right, so you got your aortic, pulmonary, Erb's point, tricuspid valve, and mitral valve. Fantastic. And now I'm just going to check some of your pulses here. Check your temporal pulse. And while I'm up here, do you have any tenderness in this area?
I do not.
Any here?
Nope.
Fantastic. Okay, now I'm going to check your carotid pulse just one at a time. And they're all full and bounding. We'll check your brachial pulses here. Go ahead and hold your wrist out like that. Perfect. Then I would check femoral. I'm going to check behind your knee here for the popliteal. And then I would check pedal. So now I will do I'm going to check your respiratory. Chest looks nice and symmetrical. I don't see any bumps, lesions, anything like that. On your back, spine looks nice and centered. I don't see any bumps, swelling, anything like that. I'm going to get back here, and I want you to take a big breath in. All right, chest expands equally. And now I'm going to put my hand in different places. I just want you to say 99 every time I move my hand, okay?
Okay.
Go ahead.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Fantastic. So we checked 10 spots there. Now I'm going to palpate 18 different spots in your back, so just bear with me here. We're just listening for vesicular sounds, brachiovesicular sounds. Okay, now I'm going to listen to those same 18 spots. You can just breathe normally through this. And now I'm going to check 10 spots on the front. I'm just going to listen to, just again, breathe normally. We'll start here. To the other side. All right, so all sounds good. Back to your heart. Your S1 closes at the AV valve, and the S2 closes at the S, or the S is the closing of the SL valves, just in case you're wondering.
Okay.
Okay, so now I'm gonna do, normally I would check your reflexes, but we don't have the hammer, so we're not gonna do that. Now I'm gonna have you go ahead and stand on up. I'm gonna check your abdomen here.
Okay.
Go ahead and pull your shirt up. Great, I don't see any distension, anything like that. Now I'll have you go ahead and sit back down and lay all the way back and hold your shirt up again, make sure it didn't change or anything. Great, that looks good. So first I'm going to listen to different spots. I'm gonna start at the right lower quadrant. You don't have to do anything special, just hang out. Okay, fantastic. Now I'm going to palpate those spots. Listen for tympanic sounds over the intestines and dullness over the organs. All right, you have any pain or tenderness with anything? Okay, I'm going to push a little here. Let me know if that changes at all. No pain, no tenderness.
Nope.
Okay, and then I'm going to have you go ahead and sit on up here. I'm going to check a couple spots in your back. Do you have any back pain or kidney pain at all that you know of?
No.
Okay. Just let me know if you feel anything. Any pain or tenderness?
No.
Okay. Do you feel any pain or tingling anywhere else in your body?
No.
Okay, well then, let's double check some things here, some sensory things. I'm gonna have you go ahead and shut your eyes.
Okay.
I want you to tell me if this paper clip is in 2 spots or 1 spot, okay?
2.
And this?
1.
And then I want you to tell me if it's a sharp or dull pain.
Sharp. Dull.
Fantastic. All right, you did great. I don't have anything else for you. Do you have any questions for me?
I don't think so.
Okay, then I'm gonna go ahead and get out of here. They'll be in to let you out here soon. Thank you for letting me see you today. And then I would shut the patient's door and take off my PPE, wash my hands, and document all of my findings.